Welcome to our JGV210 presentation. Our theme was Theme 5, HIV/AIDS, Infectious and Communicable Diseases. Our group consisted of Shannon McCullum, Kirsten Pierce, Caitlin Vinant, Hannah Falkenberg, Hannah Toogood, and Serena Sherrard. Here, HIV/AIDS, infectious and communicable diseases will be explained. HIV, human immunodeficiency virus, attacks a person's immune system. White blood cells in the immune system help fight infection, and so people with HIV are more vulnerable to secondary infections and diseases. HIV is spread via contact with the bodily fluids of an infected individual. The human body cannot fight HIV, and so HIV becomes a lifelong disease. However, its symptoms can be treated with medication, and so it is therefore incurable, yet treatable. There are 3 stages of HIV infection, and AIDS, acquired immunodeficiency syndrome, is the last and most severe stage of infection. AIDS is preventable with the use of antiretroviral medication, as these medications are designed to stop the progression of the disease. Infectious or communicable diseases are caused by pathogenic microorganisms such as bacteria, parasites, fungi, and viruses that impair one's health. These microorganisms and diseases are spread either directly or indirectly from one person or animal to another, through a range of ways such as contact with bodily fluids, breathing, sneezing, insect bites, etc. When one's health is not altered by the infection of a microorganism, the process is called a subclinical infection, and so a person may be infected without being infectious. This principle is demonstrated in vaccines and inoculations. Here is a table representing the differences between infectious and acute diseases. The length of infectious diseases depends on the severity of the disease. However, an acute disease does not last long, but has a rapid onset. Infectious diseases are contagious and spread from one person to the next directly or indirectly, but can be prevented through vaccinations, hand washing, or home remedies. Acute diseases are contagious. However, some are not. They require short-term treatment and recovery. Infectious diseases are caused by bacteria, viruses, fungi, or parasites, and symptoms are unique to that special infection. Acute viruses are caused by a virus or infection, but could also be from injury or drug and medication abuse. Symptoms involved are distinct and develop suddenly. A few examples of infectious diseases include SARS, influenza, common cold, tuberculosis (TB), hepatitis A and B, or COVID-19. Acute diseases include asthma attack, broken bone, nappy rash, or a burn. Below is a diagram consisting of common symptoms. A headache causes a tight sensation or pain in the head and eyes. One also feels dizzy. When a child is experiencing dizziness or fainting, they will report on feeling lightheaded, unsteady, or having a floating sensation. A fever is shown through a warm forehead, muscle ache, headaches, and sometimes swollen lymph glands. If the child is vomiting, symptoms of nausea, stomach cramps, and abdominal pain will show. Stomach pain includes abdominal and stomach cramps or having a bloated abdomen. Colds consist of fevers, coughs, sore throats, and a runny nose. HIV/AIDS consists of fatigue, fever, enlarged lymph glands, sore throat which leads to a persistent cough. Toothache or a loose tooth will show redness or swelling of gums with a throbbing pain in the tooth or ear. Children with sore throats refuse to eat, have difficulty swallowing, enlarged lymph glands, and fevers. A heat rash forms red bumps or blisters on the skin. A nappy rash develops red, raised, or pimple-like patches on irritated skin in and around the buttocks and private part areas. Diarrhea consists of frequent bowel movements which appear semi-liquid or completely liquid. Here are some steps in the referral process that teachers can follow. Step 1. Ensure that there are written copies of any observations made to ensure there is proof. Gain parents' trust and cooperation through either meeting with the family or written correspondence. Step 3. Copies of all screening tests should be made available to parents so that the tests can be shared with the child's doctors in order to understand the child better. Step 4. Offer information regarding local resources such as hospitals, clinics, health departments, which could potentially help the family and the learner. Step 5. It is important to have follow-up contact in order to determine whether the learner has received professional evaluation or diagnostic teaching. Inoculations and immunizations in South Africa. These procedures of vaccines are done at different ages throughout a child's life, from birth up until the age of 12. As a group, we discovered that vaccines help many infections and are available for free at state clinics. In South Africa, children are immunized against 11 infections. New advanced vaccines have been added to the government guidelines at a cost to the end user. Certain vaccines have been removed and replaced with more effective vaccines. Each baby born in South Africa is issued with a Road to Health booklet, and this is the official immunization record that is needed for clinic visits, hospital admission and attendance or acceptance at a creche and school. An interesting fact, if a baby is born to an HIV-positive woman, they should still be immunized, as they are at high risk of infection later on if they develop AIDS. Here is our bibliography for our presentation. We hope you enjoyed our video presentation on HIV/AIDS, infectious and communicable diseases, and learnt as much as we did. Thank you.